Like myself, most sickle cell patients were diagnosed from birth. Sickle cell anemia is a disease that causes severe pain crisis and organ damage. Normal red blood cells are round and flexible, which enables them to move through the blood vessels easier. Sickle cells are damaged, hardened, and they can break easily, which then causes them to clog up the veins and cause severe pain crisis. Currently, the only cure for sickle cell anemia is a stem cell transplant. A stem cell transplant or a bone marrow transplant is a medical procedure that takes the diseased bone marrow of the patient and then replaces them with highly specialized stem cells, which then creates a new healthy bone marrow and a new healthy immune system for the patient. This past July, I underwent a stem cell transplant. As part of the transplant process, required me to have a central line surgically placed in my chest. A central line was needed for chemotherapy as I underwent conditioning for stem cell transplant as well as the transplant itself. Twice a week, I have blood drawn for lab examinations from this central line. There are many types of central lines. The type that I have is a Hickman catheter, which comes about 12 inches out of my body. This type of catheter has double lumens, which means that there are 2 end pieces and 2 caps at the end of each piece. The caps keep the actual catheter itself sealed away from air so that the catheter does not get contaminated and affect the patient. The caps are changed at least every 3 days, and the dressing placed over the site of the body is changed every 7 days. This is imperative to keep the site clean because this can keep infection away, which is also a matter of life or death for a stem cell transplant patient. The first step in changing the caps and dressing is to wash your hands. While it may seem imperative, it is important to wash your hands prior to doing so in any line care procedures. Warm water and antibacterial soap should be used for 15 to 30 seconds and rinse completely. Paper towels should be used to dry your hands because a cloth towel could hold germs and old dirt. The paper towel should be used to turn off the faucet with the water. In changing dressings, you need clean gloves, sterile gloves, a central line dressing kit, including the bio patch, and also sterile drape and organized, also sterile drape, which is also in here. Next, a sterile field should be established by opening the dressing change kit and organizing supplies. Content should not be touched unless you have the sterile gloves on, which are contained inside this pack. So now, demonstrate this. The next step is to gently remove the dressing and bio patch, taking care not to pull the actual catheter out of the body. In doing this, everyone in the room should have a mask on that is within 3 feet of the patient, including the nurse, the parent of the patient, or caretaker of the patient if they're within the room, and also the patient itself if they're changing the dressing. So now could you please put on the mask that I have for you?
Is this blue out or in?
The blue side is out.
Oh my goodness.
Next, when you peel, you're going to take off the bio patch off the patient. Once this is done, you're going to check the actual site for any odor, leakage, or drainage. Also, check for redness, pus, or any soreness. If this is seen, you should finish the actual changing of the dressing and then immediately notify your doctor. This right here is the sterile drape, which you're going to place all of your pieces on. Once the inspection is complete, you're going to put on the sterile gloves. The regular gloves can be removed.
Nggak ada yang sterling.
Then you're going to take out the chlorhexidine lollipop and squeeze the sides to crack it in order to allow the saline solution to get to the sponge. You're going to test the sponge either on the sterile drape or on the sterile gloves to see if it's wet. Once you keep the wings on the side squeezed together and scrub around the site and on the line for 30 seconds. Once it is dry, once you're done, you're going to wait for the actual site to dry for 30 seconds. If it is not dry after these 30 seconds and you actually put the new dressing on, it could cause irritation for the patient. Once it is dry, you're going to take the new bio patch and place it under the actual line itself and over the site. In doing this, you're going to make sure that the blue side is up. At this point, you're going to take the new dressing, which looks like this. Most times it will be clear, sometimes it will look a little different depending on which the patient likes. You're going to peel off the sticky ends on it. Sticky back part. And then you're going to carefully place it on the line above it. Most lines are longer than this, so when you're doing it, the single piece is going to line up with this right here, either this part right here or this part right here. You're going to peel this off. Take this piece right here, peel it off, sign it, date it on the actual dog or the patient. And then you're done with this part. In this portion, now we are going to get to the changing the caps. Changing the caps is an important part also. This keeps anything that may have flown